Dr. Polly Heil-Mealey, and I want to talk to you today about circulatory systems. Now, if you look at my screen, I have a report of a lady that I worked with a few weeks ago, and she had some circulatory issues. Now, the first thing that comes to your mind on circulatory is your heart and your blood circulation. And that is one circulatory system, but actually you have two. And the second one is maybe even more important than the first one. Now, your blood circulatory system, obviously your heart, you have a heart, and the heart pumps the blood to all of your extremities. It comes back, it goes through the lungs, it does all those things that it needs to do, and it nourishes your body and it keeps your body alive. If you don't have a blood flow, guess what? You're not going to be alive for very long. So your circulatory system with your heart is very important. But there's another circulatory system as well, and that is your lymphatic circulatory system. And this is something that most people don't talk about, and it's something that you may never have even considered. So kind of want to talk to you about that today. On our instrument, we work with the EAV, which is a bioresonance device. And one of the things that we will do in the pre-test is we will see to what degree is your lymphatic system compromised. And we call that biotoxicosis. So that's just a big word, but what that means is how dirty is your lymph system. Now, we all have a lymph system. Most of you will know that your glands under your neck can be tender and they can get swollen, and mama will always check there if somebody has a fever. But you also have lymphatic glands under your armpit, down your spinal column, in the groin, and behind your knees. Now, your lymphatic fluid, most people don't know what that is. You know that your blood fluid is red. Blood, it's red. Well, your lymphatic fluid is clear and it's very thin. Now, the only time you probably have ever seen your lymphatic fluid is if you get a blister and you pop that blister, that clear fluid there is your lymphatic fluid. If you have a sore, if you have a cut, if you have an infection and you get the icky pus stuff, well, that also is your lymphatic fluid. Your lymphatic fluid has a lot of your white blood cells in it, and it fights infection. Now, this is what people don't know. If you took all of your lymphatic vessels out of your body and you lined them up end to end, do you know that that lymphatic river from your body would be longer than all the rivers in all the world lined up end to end? So we are, in fact, fearfully and awesomely made. Now, your lymphatic system can get congested. If you'll look on the screen here, on this particular column, I think it's column number 5, it talks about biotoxicosis. Now, this particular individual is toxic in her lymph at the 2nd level. You've got 3 levels in your lymph. And what we want to do is know to the degree that the lymph is toxic, because if your lymph is toxic, then your body's going to be sick. Now, in the iris of the eye, there are some markers that we look at, and the eye will tell us if the lymphatic system is under some distress or it is compromised. Your lymphatic system has these little Pac-Man creatures, and for those of you that are old enough to understand a Pac-Man, that was one of the very first video games. If you're younger than 30, you probably just don't have no clue, but that's okay. In your lymphatic system, in your lymph nodes, you've got these little Pac-Man creatures, and they eat up all the bacteria and the viruses. But that is only if your lymphatic system is flowing the way it should. Now, your lymphatic system is the vacuum cleaner of the body. It goes through all the body and it cleans up all the metabolic waste. The metabolic waste is what happens when your cells, and do you know you've got about 70 trillion cells in the body. Some are dying, some are being reborn, but all of them need to be cleaned. The ones that are dying need to be swept away. If the lymphatic fluid is thick and congested, it's not able to do its job. Now, we talked about in another video the importance of moving your bowels. Now, you need to move your bowels 2 to 3 times a day, every day, in order for your body to be a flow system. The liver, in turn, will take the metabolic waste from the blood, and it will process them, and the waste materials will go through the bowel and out of the body. If those 2 things are working properly, then the lymph can go throughout the cells and clean up all that metabolic waste, come down to the liver, dump it in the liver, and so on and so on. So, a lot of times, if our channels of elimination are not open, then we have a serious lymphatic disorder. Now, we don't want to wait until you get a diagnosis of lymphoma or leukemia or any of those dreaded diseases before we work on the lymphatic system. This is one of the things that we will work on at the very beginning, because you know, in your home, if you don't have a vacuum cleaner, what happens? The ick begins to build up. In your body, if you don't work with the lymphatic system, then at the cellular level, guess what? Ick begins to build up. And it is much more simple and much more cost effective to clean the lymph and to keep the lymph flowing before you get ill than to try and reverse the whole disease process. So hopefully you'll take better care of your lymph. If you need any help, you can always give us a call. And remember that you too are fearfully and awesomely made. Thank you for joining me today.